We talk about it a lot, but I think we should. Tell us about this condition and why you chose to focus on it, especially when it comes to health, bone health in women.
Well, I mean, first of all, thank you for letting me talk about it, because you're right. We don't talk about it enough. Osteoporosis, as you mentioned, has a very high morbidity rate, meaning the problems that come along with fracture is very high, meaning you could potentially die after a fracture. A third of women and men after a fracture will actually pass away within 12 months. The loss of...
Why is that?
Wow.
Because you sound like people get fractures and they deal with it. Why?
So a lot of it has to do with who is actually having fractures. Some of these patients are older. They're very frail to begin with. But we're actually seeing fractures younger and younger too. And so while the mortality, the death rate is very high and alarming, it's actually the loss of independence that I think is more important. And not that death isn't important, but we see so many women especially lose independence much earlier in life than we would anticipate. And it catches them off guard because we're not talking about it and we're not screening.
Well, I feel like orthopedic surgeons, you often see an orthopedic surgeon for the first time when you've already had an injury. Right. You know, you're going in because you need something fixed. And that doesn't sound like we're prepping in the right way or avoiding this in the right way. So what should we be understanding? What should we be talking about? What should we be doing to actually prevent having to go see you?
So there's two huge things here. No, it's fine. I actually don't operate anymore because I actually am now in the game of prevention. I want to educate. I want to prevent. And so there's two main things to think about here. One is screening. So screening earlier. Right now, the recommendations from some of the governing bodies like the USPSTF, United States Preventive Services Task Force, recommend screening for women at 65 and men for 70 if they have risk factors.
That seems old.
It is way too late. And I understand they do it because of the statistics, and I get it. But we should be screening, especially women through midlife, perimenopause, and menopause, because that is the opportune time to intervene, especially when we talk about hormone therapy.
Well, let's go there, because I feel like in the last year or so, we've had a whole kind of enlightenment about some of the research that's been done when it comes to women and hormonal therapy. So what have we learned, and what do we need to know now going forward?
Well, this is a really fun space for me to talk about, because this is where we get to talk about hormones in a different light. For the last 20 plus years, we've been living in this sort of fear, use as little hormone as possible, only treating symptoms. Those are what the guidelines actually still say for the most part, is treat symptoms of menopause. But when you look at hormones through the lens of bone health, we have the opportunity to start saying, wait a minute, the lowest dose that treats your symptoms might not actually be enough to treat your bones, to prevent bone loss. And yet estrogen, is FDA approved for the prevention of osteoporosis. But if we're not measuring it, then we don't actually know that it's doing what we want it to do. And this is where we have to get into a new space of hormone optimization rather than just hormone replacement or menopausal hormone therapy.
What happens to people who've missed that window? I think about, this is where, every day we're learning how to treat various ailments across the spectrum, if you will. So what happens for those who've missed out? And obviously we're getting enlightened about for the next generation, if you will.
Sure. There's a lot of opportunity to talk to different groups of women here. For the women that went through menopause over the last 20 plus years, many of them are traditionally, quote unquote, beyond the window of opportunity, which is within 10 years from menopause, right? I talk to a lot of these women in their 60s and 70s every day, and they are angry that they didn't have that conversation, that opportunity was robbed from them. But at the same time, the research actually supports there is opportunity for some of these women, especially the women 10 to 20 years from menopause. So this is most women in their 60s. It's not necessarily too late. We just need to take individual risk factors into consideration. A lot of doctors, unfortunately, are still treating as if any time after 10 years out from menopause is too late.
That's what I feel like. As a woman, as the mother of a daughter, it is fascinating to see I have a 23-year-old daughter, going into various medical offices and how they're treated, how we're treated. It's not always so ideal in terms of being open to what you say about yourself or the questioning of, well, maybe that's, not kind of really thinking about the diagnosis and maybe pursuing what's wrong.
I think you're saying it nicely.
I'm trying to be careful here, but you know what I'm saying.
Absolutely. No, absolutely. It's
really, why is that still?
I think there's a lot of reasons. I think for most of modern medical history, we have not treated women as individual. Women are different than men.
Yeah.
The sexes are different. Women have different needs than men's. And the research shows that. research has mostly been done on men until very recently. There's very little funding for women in medical research, even currently.
Amazing.
And so doctors, I think for the most part, mean well. They want to treat their patients, but a lot of times they don't actually have the tools they need or the knowledge they need to treat a woman as a woman, which is really unfortunate. On top of that, there is this underlying just paternalistic nature of physicians that when it comes to women, we tend to tell them what to do, versus when it comes to men, we tend to educate them on the risks and let them decide.
Is this being taught in med school these days at all?
Which part?
Like what you just mentioned, like what we've tended to do and what physicians have tended to do. and ways to avoid that bias when it comes to treatment.
Not in my medical school training. No, we do learn from our mentors, though, right? Yeah. So these are how things get passed along from generation to generation in medicine. This is how these biases get passed down.
Real quickly, got about 40 seconds. I'm going to go 3 things. Calcium and vitamin D, important?
Yes, but it's just one part of the bigger picture.
Doing weights.
Absolutely important.
What's the other part of the picture that people should be thinking about here?
Get screened early, optimize hormones, resistance training, and impact if you can do it. That's the recipe. And food.
Peptides?
Eat a whole food diet.
Peptides?
That's a longer conversation. The answer is maybe. There's a lot of research coming, though.